I'm Dr. Gawel from Indian Trail Animal Hospital, and today we're going to talk to you about senior care and our feline friends. I just love the older cats and the families. With their personality quirks and their behaviors, by the time they reach 13, 14, 15, they have really established and ingrained themselves as the king and queens of those households. So what are the kind of the signs and symptoms that we want to make sure our senior cats are staying healthy inside your home? Well, even though cats are such good little hunters, we do like to think of them as a little bit lower on the totem pole in terms of they're more prey animals, okay? And so what that usually means is that they're really good at hiding clinical disease and illnesses. So there may be more subtle signs and symptoms that your senior cat is exhibiting that may indicate a disease or an illness or just pain, not feeling well at home. So what are those clinical signs? We talk about when a cat is sleeping more and their social patterns and behavior change. So maybe they're not coming out and seeing you when you get home from work or spending time on the couch as they usually did. Any kind of indicator or clue that their social pattern has changed may be an indication that something's not quite right. Less attention to grooming is another big indicator. So if you see your cat developing more mats or have kind of a flaky, dandruffy skin, that could be an indicator of both internal and external disease processes. Another one is gait and movement. So normally a cat that jumps up and down onto inclines, moves up and down the stairs with ease. If you're now seeing him or her kind of stretch up towards that incline and take it one step at a time, that may be an indicator of pain or joint disease. Same thing happens when we see them come up and down off of certain inclines. So if there seems to be a hesitation, they don't want to jump or leap as often as they did. Now you see a more deliberate step down. Could be an indicator that something's not quite right. We talk about less appetite than usual. So I don't mean not eating anymore, but maybe there's a hesitation to eat. Going over that dry food and over to the bowl, they sniff, they smell, they walk away. Or maybe it just takes longer for them to eat. Could that be an indicator that there's something wrong with gastrointestinal disease? They're nauseous, they don't feel well, or dental disease. Is it hurt to eat and chew and bite into those things? Then, of course, we get into our more obvious clinical signs and symptoms. So anything from you're scooping out urine in the litter box more frequently, there's changes in the bowels, vomiting, no appetite, as well as significant weight loss. So what exactly can we do to keep these guys healthy? Well, diet and nutritional needs will change as a cat gets older. So you'll see all kinds of diets out there for senior care, weight loss. We will see indoor formulas, as well as other specific health conditions. It's a great idea to have that examination scheduled so that we can see where those needs may lie with your older cat and we can make the right recommendation. As I mentioned, annual exams or semi-annual exams are extremely important for our senior cat care. So this is a time when we can examine the heart and lungs, look at the coat and skin, feel the joints, look at the teeth, the eyes, the ears, all of these indicators and external clues that can help us make sure that your older cat is healthy. We recommend blood work annually for every senior cat. This is very, very important for looking at the internal health of these guys. So we can check for early indications of kidney disease, thyroid disease, or even diabetes, 3 pretty common ailments that we see in our senior cats. Last but not least is checking for hypertension or high blood pressure. Older cats, 13, 14, 15, are apt to develop high blood pressure as they get older. What's most important for our older cats, and that's to still remember to give them the love and attention they need. So they may not run around the house like they used to, chasing after balls or toy mice or going crazy climbing up that cat tower like they used to. But that doesn't mean we can't offer them certain types of stationary stimulation and play. There are plenty of cat toys out there and puzzle toys that allow you to place in front of that cat and they can still use their sight, their smells, and their tactile function to kind of keep them stimulated and keep them happy. If you have any questions or concerns about senior cat care, please give us a call today.